Yobe State is gradually recuperating from the 14-year Boko Haram insurgency as the state government takes steps to return the displaced persons as well as to rebuild structures destroyed by terrorists. Governor May Malabuni had over the last 5 years made progress in the health sector by either constructing or rehabilitating 139 healthcare centers across the state out of the 178 proposed. The government also succeeded in building one of the largest maternal and child hospitals in Nigeria with over 300 bed capacity, as well as upgraded 4 general hospitals to specialist hospitals in the state.
In his inaugural speech of his initial first-term inauguration as governor of Yobe State, he made a commitment to establish at least one functional and standard primary healthcare center in each of our 178 political wards, and he matched that commitment with action. By 6th of December 2019, he laid the foundation for the first primary healthcare center he was establishing, and as I speak to you now, 139 have been completed.
While the Commissioner for Health speaks on the efforts in providing manpower for the new health facilities, the Chief Medical Director of the State University Teaching Hospital says it has now gone paperless in its operations.
I'm very much pleased to tell you that for the past 1 year or so, we have been on electronic health record system. We are almost going paperless. You come to the hospital, the doctor sees you, and then our radiology department runs what is called the PAC system, that is picture archiving and computerized system, in which without the film, both the report as well as the x-rays or the MRI or the CTs that are taken will be sent directly to your doctors, who will have access on their computer at the touch of a button or the click of a computer mouse. They will be able to see all your results from the lab as well as from the x-ray department.
Of recent, His Excellency gave approval for the incentivized employment of 25 consultants into the system. In addition to that, His Excellency has employed over 200 nurses, and presently we are also waiting for the approval of another 200 nurses into the system. And this is in addition to the automatic employment of medical doctors, the indigenous medical doctors that have completed their NYSC. Or they are coming for housemanship, automatically they are employed into the system.
To provide universal healthcare coverage, Governor Buni also established 4 new healthcare agencies in the last 5 years, including contributing healthcare scheme and emergency medical ambulance services.
We are there to respond to emergencies like medical emergencies, pediatric emergencies, obstetric and gynecological emergencies, poisonings and drugs emergencies, including cases of gender-based violence where there are needs for emergencies. Ours is to ensure that whenever there is an emergency, we are there within a limited period of time with our ambulances and ambulance crew to evacuate the person from danger and directly send to a comprehensive hospital for further treatment.
And another very important program under the state is the State Equity Program. For us to achieve universal health coverage, which is access to healthcare services across board, we need to have more of the vulnerables into the scheme. That was the reason why the state government made available some funds in the year 2022. The state government made available the sum of 200 million naira for us to enroll vulnerables in the society.
The state, having also allocated 15% of its 2024 total budget to the health sector in compliance with the Abuja Declaration, it is believed the challenge of inaccessibility to healthcare in the state would be reduced.